Assalamu alaikum and welcome to the new lecture on pharmaceutics, the dosage form science. I am Shoaib Muhammad, lecturer in the Department of Pharmaceutics, Faculty of Pharmacy, University of Sindh. In this lecture, we will be discussing about the otic and the nasal preparations. And the material for this lecture has been taken and adopted from pharmaceutical dosage forms by Ansel. So this is the outline of the current lecture. In this, firstly, we will be discussing the otic preparations. That will include the introduction of the Otic preparations, cumin removing solutions, anti-infective, anti-inflammatory and analgesic Otic preparations, the preservation, stabilizing and packaging of the Otic preparations. Then we will be discussing the nasal preparation. Firstly, there will be the introduction of the nasal preparations. Then we will go to the details of the nasal decongestant solutions, nasal inhalations, vaporizers and the humidifiers. So first, the Otic preparations. So the preparations that are used into the air for treating the elements of the air are called as the Otic preparations or the air preparations. The air preparations can be given into solution form, suspension form, as well as into the ointment form. These preparations are mostly applied into the air canal to treat the elements of the air. However, if there is any problem with the external air or external parts of the air, the dermatological preparations will be used to treat those conditions. So there are two major categories of the otic preparations. First are the cerumen removing solutions, and second are the anti-infective, anti-inflammatory, and analgesic otic preparations. Firstly, the cerumen removing solutions. The cerumen is a combination of secretions of sweat and sebaceous glands of the external auditory canal. Now, when these secretions dry, they form a thick, sticky semi-solid mass that holds the shed epithelial cells, fallen hairs, dust, and other particles so that these things may not go inside the air. Now, sometimes there may be excessive formulation or accumulation of this thick, sticky semi-solid mass, and as a result of it, the patient may feel pain, itching, and impaired hearing as well. Now, if the cerumen starts to accumulate and cause itching and pain and hearing problem to the patient, this requires to be removed, and it can be removed by the use of synthetic surfactants such as the triethanolamine, polypeptide oleate condensate, commercially formulated propylene glycol that are used, and these emulsify the cerumen and remove the wax. The carbamide peroxide in glycerine and propylene glycol are also used for removing the cerumen and the wax. How these preparations are used? Firstly, there is administration of the Otic solution that is used into the removal of the wax or the cerumen into the air at the head position of 45 degree, and then putting a cotton plug. Then we will wait for 15 to 30 minutes, and then we will flush the air with lukewarm warm water, and then by the help of a rubber syringe we will remove the cerumen. The next major category of the air preparations are the anti-infective, anti-inflammatory and analgesic preparations. The air might got different type of the infections, and because of that the patient may feel the pain, or there may be presence of the inflammation as well. So if the patient is suffering from any kind of the infection into the air, so different types of the anti-infectives are available that include the antibiotics and the antifungal agents, like chloramphenicol preparations are also available for the air. Chloramphenicol is an antibacterial. Colistin sulfate, neomycin, and polymyxin B are also antibacterials and can be used in different type of the infections into the air. Nystatin is an antifungal agent and can as well be used into the fungal infections of the air. These preparations are most often formulated as airdrops in a vehicle of anhydrous glycerine or propylene glycol. In most of the situation, if the preparation is given indirectly into the air, the preparation or the drug will be producing effect. But in other situations, medications will also be given orally, so the drug will be acting on from the both sides, from the local when it is given in directly into the air, and as well as through the systematic circulation when it is given orally. So more it will be more effective to use the drug by these two routes of the administration. If along with the infection the patient is also suffering from the pain, so we can go for the antipyrine, that is an local analgesic drugs, and it will relieve the pain symptoms. We can also use the lidocaine, benzocaine, and demicaine. These are basically the local anesthetics. They decrease the pain symptoms by desensitizing the nerves, and they can as well be effectively used for relieving the pain symptoms. And these drugs, of course, are used along with the anti-infectives if the patient is suffering from the pain symptoms as well. If there is also presence of the inflammation into the air, we can go for the anti-inflammatory agents, and the corticosteroidal drugs are very effective in the treatment of the inflammations. So we can go for the use of the hydrocortisone, or we may go for the use of the dexamethasone sodium sulfate. If the patient is suffering from the otitis media, the otitis externa, the inflammation of the external air, the acetic acid 2% in aluminum acetate solution and boric acid in the concentration of 2.75% in isopropyl alcohol can be used as non-potent drugs, and they will treat the inflammation of the in the otitis externa. In the case of the otitis media, that is the inflammation of the middle ear, we can go for the analgesic antipyrine. We can also go for the local anesthetic benzocaine in a vehicle of propylene glycol or anhydrous glycerine. The air preparations also require the preservations because these are the multi-dose containers, and there are chances of the growth of the microorganisms. So we will have to use the preservatives and the chlorobutanol in the concentration of 0.5%, thimerosal in the concentration of 0.1%, and combination of the parabens are effective as preservative into the Otic preparations. Sometimes we have to also maintain the stability, maintain the pH of the preparations, and or we have to control the uh, oxidation processes into the preparation, so the preparation may not be oxidized, so we might have to use the antioxidants, and sodium bisulfate has been an effective antioxidant into the air preparations. About the packaging of the air preparations, the containers for the air preparations are mostly about 5 to 10 ml glass or plastic bottles that contain the dropper at one end, and by the help of the dropper the preparation can be easily inserted into the air canal. Next we have the nasal preparations. The nasal preparations are the preparations that are used into the nose. These preparations mostly contain the adrenergic agents, and they are very effective for their decongestant activity onto the nasal mucosa. Mostly they are given into the solution form and administered as nasal drops, but sometimes jellies are also available for administration into the nose. The preparations that are given through the nose include the nasal decongestant solutions, nasal inhalations, vaporizers, and the humidifiers. The nasal decongestant solutions are mostly the preparations in which the drug is present in an aqueous solvent. These preparations are also required to be isotonic to the nasal fluids, and that is approximately the 0.9% of the sodium chloride. This preparation should also require a buffer to maintain the pH in the range of the nasal fluids, that is the 5.5 to 6.5. Antimicrobial preservatives are also required for these preparations, and we can use benzalkonium chloride or ethylene diamine tetrachloride for the preservation purpose. The concentration of the antiadrenergic agent in these preparation range from the 0.05 to 1%, and these preparations used in the rhinitis of the cold, that is the inflammation of the nasal mucosa due to cold; vasomotor rhinitis, that is the inflammation of the mucus due to the dilation of the blood vessels into the nose; allergic rhinitis is because of the any kind of the allergy to the patient to some kind of the substance, and they are also used into the hay fever and the sinusitis. These preparations should be used for a shorter period of time, and the use of this preparation for the longer period of time may again cause the edema of the nasal mucosa, that is called as the rhinitis medicamentosa, means rhinitis caused by the drugs. So as earlier said, these preparations are used for a shorter period of time, so their use should be limited to 3 to 5 days. The most of the adrenergic drugs used as nasal decongestion solutions are synthetic compounds, similar in chemical nature, pharmacological activity, as well as the side effects to parent compounds that are naturally occurring. That is basically the epinephrine. The epinephrine as a pure chemical substance was first isolated from a suprarenal gland in 1901. Epinephrine is also known as the suprarenin and adrenaline. The solutions for the nasal use are packaged in dropper bottles, in plastic spray bottles, usually containing 15 to 30 ml of the medicamentation, so that they can be easily inserted into the nose. Next, we have the nasal inhalations. The nasal inhalations may produce a local effect into the nose, or they may go into the lungs, absorbed systematically, and produce a systematic effect as well. These are available into the solution form, gas form, fine powders form, or a fine mist form. They may be divided into the two major categories. One are the aerosols, and second are the atomizers or the nebulizers. Through the aerosols, they act onto the bronchial tree, and they are of the few micron size. So when we are giving an aerosol through the nose, the micronized drug will go through the respiratory tract into the lungs and produce the effect into the lungs, and even they may be absorbed into the systemic circulation. Into the atomizers or nebulizers, as we have earlier discussed, there will be an equipment which will be nebulizing the drugs, which will be converting the drug into the mist form, and there will be a device which will be inserted into the nose, and the mist will be going into the nose, and that will be producing the local effect into the respiratory tract as well as into the lungs. They produce a particle size ranging from 0.5 to 5 micron. Next, we have the vaporizers. These are the specialized equipments that produce fine mist of steam. And in these type of the equipments, we mostly use the volatile substances. The medication that is volatile in nature is added to water in the chamber of this equipment, and and the special medication cup, and then by the help of this equipment, the medication volatilizes, and the patient takes up that steam through the mouth and as well as the nose into the respiratory tract, and those vapors produce effect into the patient. Finally, we have the last type of the nasal preparations, that are the humidifiers. Now, humidifiers are also a special type of the equipment, and these provide cool mist that is costly because these equipments consume electricity, and they are continuously operated onto the electricity. As earlier discussed with the humidifiers, into the humidifiers the patient only goes near to the equipment and takes up the steam or the volatile drug into the respiratory tract. However, the humidifiers convert the whole atmosphere of the room and spread the drug or humidify whole of the room. and because these are operated on through the electricity, and they are operated for a continuous time period, so they are also producing the time, producing the noise. And as they are humidifying the room, the drug or the vapors may be present in whole of the rooms, so the minerals and the moisture will be also accumulating onto the furniture. They will be causing the damage of the furniture, and even they can decrease the room temperature up to 1 to 3 degrees Fahrenheit. These are mostly used into the colds, cough and the chest congestion problems. So this is all about the nasal and the otic preparations. Thank you very much for your time.